Hello and welcome to this Friday weekly webinar. Today to talk about breast cancer awareness, we have with us Dr. Geeta Kadayaprath ma'am, who is Senior Director Surgical Oncology Breast, Max Super Speciality Hospital, Patparganj, Delhi. आपका बहुत बहुत स्वागत है मैम इस कार्यक्रम में. A very warm welcome to this platform, ma'am.
Thank you so much.
We also have with us Communication and Documentation Officer of MDNIY, Mohammad Tayyib Alam sir with us. आपका भी बहुत बहुत स्वागत है सर. Director of MDNIY, Dr. Ishwar Basavaraddi sir will be joining us shortly. Now, as per the tradition of our institute, let us start the program with prayer. Om Sahana Vavatu Sahano Bhunaktu सह वीर्यं कर्वावहै तेजस्विनावधीतमस्तु मा विद्विषावहै. ओम शांति शांति शांति. जैसा कि हमारे दर्शक जानते होंगे कि अभी 4 फरवरी 2023 को हमने वर्ल्ड कैंसर डे मनाया था, ऑब्जर्व किया था. इसी संदर्भ में आज ब्रेस्ट कैंसर अवेयरनेस विषय पर बात करने के लिए हमारे बीच मौजूद हैं जानी मानी ऑन्कोलॉजिस्ट डॉक्टर गीता कादयाप्रथ मैम. मैं एक बार फिर मोरारजी देसाई राष्ट्रीय योग संस्थान की तरफ से और स्वयं अपनी तरफ से आपका हार्दिक स्वागत अभिनंदन करती हूँ मैम. आपका बहुत बहुत स्वागत. इसके साथ ही मैं स्वागत करना चाहूंगी संस्थान के संचार एवं प्रलेखन अधिकारी मोहम्मद तैयब आलम सर का भी, कि वो हमेशा हमारे कार्यक्रम में बने रहते हैं. आपका भी बहुत बहुत स्वागत सर. I also would like to welcome Dr. Ishwar Basavaraddi sir, Director of MDNIY. आपका बहुत बहुत स्वागत सर. Now I would like to request Mohammad Tayyib Alam sir for further proceedings. Sir. Tayyib sir.
Sorry, sir. Sorry, sir. Good evening. Thank you, Dr. Vandana. Good evening, everyone. Am I audible?
Yes.
Vandana, am I audible?
Yes, sir. Yes, sir.
Respected Dr. Geeta Kadayaprath ma'am is a Senior Director, Breast Surgical Oncology, Oncoplastic Surgery at Max Institute of Cancer Care, Patparganj and Vaishali. Ma'am has done her MBBS from Lady Harding Medical College, MS from Mount Azad Medical College, FI from Glasgow, UK. Ma'am was one of our Europe at the Royal Hospital London, UK from 2003 to 2004. Ma'am has over more than 24 years of experience with exclusive surgical oncology, experience of 20 years, and has pursued her in breast cancer for a large part of the. Ma'am has also worked with the Cancer Institute, New Delhi, and Apollo Hospital, New Delhi, and various other leading hospitals of different part of India. Ma'am is an expert at performing the entire range of surgeries for breast cancer. She has contributed actively as an author, co-author in several papers in peer review journals, and participated in several national and international conferences. Ma'am has been organizing secretary of several innovative breast CMEs and conferences, which enjoy huge popularity and postgraduates, general surgeons, and oncologists in the country. Ma'am is associated with various societies and bodies, such as a member, such as an Association of Surgical Oncologists, Association of Surgeons of India, Association of Breast Surgeons of India, Indian Society of Oncology, Oncology Forum Delhi, and many more. Thank you, ma'am, for accepting our invitation for the weekly webinar. In fact, in a weekly webinar, it's a Friday webinar, which is with these few words, now I would like to invite Dr. Ishwar V. Basavaraddi, Shah, Director, Murarji Desai National Institute of Yoga, today's topic, awareness of breast cancer, which is much needed in the quite time.
Shanti, Shanti, Shanti. Today's esteemed speaker, Dr. Geeta ji. Namaste. My colleagues in the Institute, Geeta ji, Dr. Vandana, the coordinator webinar series. My faculty members, student friends, yoga enthusiasts joining this webinar through various social media platforms across the globe. My greetings to you all, pranams to you all. At the outset, once again, I welcome Dr. Geeta, an eminent oncologist, for accepting our humble invitation and give some very knowledgeable guiding principles for the general public and also particularly for the yoga professionals about the breast cancer and its management. Today, if you see the surging of this widespread various types of cancers, where women are the major victims in several cases. Police maybe then breast cancer is dominating, but at the same time, it could be well managed by medication and various oncological procedures. And today, just in the evening, we are viewing. There are more than 700 research papers in yoga on the cancer care, about yogic management of cancer care. So it may be during some of them are advocated some yoga practices while giving the chemotherapy, radiotherapy, etc. Then after rehabilitation procedures, then after completely overcoming, that's one thing. But here it is about we have to bring the awareness about the women's population. So what is the age? What are the symptoms? What are the causes of breast cancer? How we can prevent them? And with our lifestyle, etc. I hope so. Our today's learned scholar will throw light on these various dimensions of breast cancer and its prevention. With these few words, I welcome Dr. Geeta and request her to deliver on the topic breast cancer awareness. Professor Geeta.
Thank you so much. Thank you very much for this kind invite. And it's a pleasure to be with you because I think the institute that you run itself is meant to actually, improve lifestyle. And yoga is something that is, philosophically very, very Indian. And it tells you, the way to live a healthy life. And I think that is what possibly we have forgotten as we have grown, and now the focus is back on these practices, which certainly improves the lifestyle and improves uh, people's health as such. And this is what is most important in preventing these diseases which seem to be on the rise. So I'll just share my presentation just to put it in a more lucid manner. Are you able to see my slides?
Yes, ma'am. It is visible.
All right.
Okay.
So do you want me to speak in English, or do you want me to speak in Hindi?
Ma'am, whichever language you prefer.
So I can do a bit of, possibly a bit of both, huh? Okay, so what we're going to talk today is about breast cancer. So this is, February 4th is celebrated as World Cancer Day. And this month is, observed as the Cancer Month, Cancer Awareness Month, rather. And it is important for all of us to pick up those, the signs and symptoms. That is, of course, very important. But then we have to work on how to prevent it also. And that is something like you would be hugely involved in, because I think, yoga is one of those very, very important methods which is reaching out to the whole world in creating health, good health, and also a good, I think, psychological space, because yoga is not just about exercises, it is also about improving the state of your mind. So we are going to talk about breast cancer awareness. So my PowerPoint is going to be both Hindi and English. So if there is any, if you want to go back to Hindi, you can. So the important question to ask is, when you're talking of cancers, can we detect it early? So if we can detect something early, obviously it is understood that the outcome is going to be so much better. So there are some cancers where you can detect it even before the symptoms appear by carrying out certain tests. So in breast cancer, we usually talk about early detection. Although though there is work in progress, there are some blood tests now coming up slowly, which is going to actually be able to pick up breast cancer even before it shows up radiologically, about 8 to 10 months prior to it. But this is all happening, and as we speak. But as of now, as the larger in the larger context of our country, the important thing is early detection. Because if it is detected early, then the chances that one would survive the cancer is very, very high, approaching 100%. So when we talk of breast cancer, everybody asks why ये होता क्यों है? तो ये होता क्यों है? क्योंकि उसकी कोई वजह नहीं है. You cannot say that there is one particular reason as to why it is happening. There are some risk factors. So when we talk about risk factors, you would possibly speak about non-modifiable risk factors, which would involve family history, genetics, personal history, various types of cancers, your menstrual history, and race. And I will come to all of this in a little bit of a detail. And then there are modifiable risk factors. These are risk factors on which you have some control. Non-modifiable, you cannot change, but modifiable, you can. And in that, your reproductive history, when you have your children, your oral contraceptives and hormone replacement therapies, alcohol, weight, all of this is part of the modifiable. So let's come back to the non-modifiable risk factors. These are there, you cannot change it, but you should be aware of it. And of course, the biggest risk factor is the fact that you're a woman. If you're a woman, you have 100 times larger chance of having breast cancer. It is that much more common than in men, but that does not mean it does not happen in men. So every year, 1% of breast cancers happen in men also. So as if you talk about age, as one grows older, the mechanisms of the body start failing, the repair mechanisms in the genes become weaker, and they're not able to sustain it. That is when cancers happen. So we do know that about 75 to 80% of breast cancers also happen over the age of 50. And the important thing to understand in our country is that we are seeing quite a few breast cancers happening in young women. So when I say young, I mean less than 40. We see about 14 to 15% of breast cancers happening in women under the age of 40, which is almost double that what is happening in the West. So in the West, that age group is a 7%. If you talk about family history, so we pay a lot of attention to family history. So whenever we get a patient in the outpatient, they'll say, हमें तो हमारे घर में तो किसी को भी नहीं है डॉक्टर साहब, तो हमें कैसे हो गया? So the important thing to understand is that about 80 to 90% of women will not have a family history and still get breast cancer. So let's not just think that family history is the only overriding factor as far as the causation of breast cancer is concerned, but it is a mix of various factors over which possibly you don't have control. And then when we talk of genes, of course, when a cancer happens, there is something happening at the genetic level that eventually gives rise to cancer. But those genes that are transmitted from a parent, it could be mother, father, whichever, and it could be transmitted, and that could be the reason for breast cancer happening in only 5 to 10% of cases. So even in terms of genes also, we tend to put a lot of emphasis that possibly a genetic mutation is giving rise to it. But as of today, what we know is that about 5 to 10% of cancers have a genetic basis and 90% don't. So if one already has dealt with breast cancer, then we do say that yes, the chances of developing cancer on the opposite breast does go up. So there is a 3 to 4-fold increase. If I were to put it in terms of per year chances, then there is a 1%, close to a 1% chance of developing breast cancer in the opposite breast, meaning at 5 years, the risk would be, say, 5%, at 10 years, 10%, and so on. So another thing that one has to be very, very careful about is a lot of women and young women, they have these lumps in the breast which are removed but never tested. It doesn't go to the pathologist. It is taken out and it is discarded, which is not the way it should be, because sometimes these, these lumps could be hiding the reason as to why a cancer may happen subsequently. And also the exposure of the body to hormones. So if a girl were to have her periods early, and the same girl, when she grows up to be a lady and she goes on to be menopausal, if that is delayed, so the period of exposure to hormones is that much longer, and that can also increase your risk of breast cancer. And then there are certain races. The most well documented race is the Ashkenazi Jews in the Middle East and West Asia, where you would find this group of this particular race having a higher incidence of breast cancer, and that is largely because of consanguinity. And I'm sure you would be aware of such communities in our country also, where uncles getting married to their nieces, or cousins, first cousins getting married to each other. So there, what happens is the diversification of the gene pool suffers, because you're actually narrowing the genetic pool, and that is when mutations happen and can give rise to not just breast cancer, but several other cancers also. So now let me come to modifiable risk factors. So there are certain risk factors over which you do have some control. Like having children early is protective. So the wisdom is that you should have your children before the age of 30, preferably. But even if you plan to have it later than that, you must try and have children early, because that is protective. And having no children does add to the risk of developing breast cancer. But remember, don't look at each of these risk factors separately. One risk factor is possibly not good enough to increase your risk, but always there is a combination of risk factors. It's a constant interplay between your lifestyle, your genetics, and your environment. The other thing is oral contraceptives, although the association is not very strong, but those women who consume oral contraceptives for a very long period of time are advised not to do that, because till lately it was not seen as a risk factor. But hormone replacement therapy, it is well documented that if one were to have hormone replacement for more than 5 years, in the late 90s, this was hugely in fashion, especially in the West, because women used to be having a lot of difficulty coming to terms with menopausal symptoms like hot flushes. Their bones were giving up on them. There were cardiac issues. And to bring them back to a normal state, hormones were supplied from outside. Women used to take tablets of hormones to restore their hormonal environment. But the trade off was that it did increase the risk of breast cancer by 3 to 4 times. And this risk would return to normal only after 5 years of stopping hormone replacement therapy. So, in the early 2000s, when a million women study was done, they realized that this is not really working. And that is when hormone replacement therapy went out of fashion. And then, of course, I need to touch upon alcohol use. Alcohol is something that is not just restricted to men anymore. It is women also consume alcohol, and the WHO dictum is no alcohol at all, because alcohol is associated with the causation of a lot of cancers. And if one must, then you should not have more than a drink a week, because if you were to take consume 2 to 5 drinks per day, it would increase your risk by 1.5 times, which is quite significant. And of course, now the next epidemic that we are looking at, possibly in India also, which is something that the West is already dealing with, is obesity. And obesity has been associated with a lot of not just cancers, but whole lot of illnesses, whether it is cardiovascular diseases or stroke. And obesity, because fat by itself, excessive fat is a good ground for inflammation, and repeated inflammation may be leading to a lot of cancers. So it is important to maintain your weight. And I'm sure you, as yoga practitioners, would certainly be focusing on keeping your weight within normal limits. Your BMI should be less than 25. So physical activity is very important. It is heartening to see that, especially you would see a lot of young men and women indulging in a lot of physical activity, but then you have another bunch of young individuals who do not spend any time at all in physical activity. It has been seen that those women who are exercising before a diagnosis of breast cancer, and suppose they do get breast cancer and they do continue to exercise, their outcomes are much better than those who do not. So you don't have to do too much. You have to spend about 2.5 to 3 hours a week of moderate activity. And I think yoga fits in beautifully into this ambit, because yoga is something that everybody can do, and you don't really need too much of equipment. You can do it in the confines of your house. You can do it sitting on a chair if you can't sit on the ground. So it's a great method of restoring physical activity to yourself. And it has been increases as we go to a stage 4, where the disease has spread to other organs, then the chances of doing well does go down significantly. So it is important to pick it up early. So I will tell you how to pick it up early. So there are 3 methods, and this have to be used in combination. So one is a screening mammogram. So in our country, we do not have a screening protocol, but clinical breast examination and breast self-examination are things that one can do. So if I were to talk about a mammogram, so now what happens in the West, there is a lot of debate as to whether you should be doing between the age of 40 or 50. So if you do not, if you look at them, what they have now come to a middle path, and they start screening after the age of 45. But there is another group in the US which says after the age of 50. That is about mammogram. Mammogram, I will just come to the mammogram, what it is. So clinical breast examination is performed by a doctor. So over the age of 40, you should be doing it every year. You should just make a visit to a breast surgeon to get your breast examined, and also to learn the next thing, which is the breast self-examination, which is the best weapon in your hand. Something that you have to do and get familiar with is breast self-examination, because that familiarizes you with your breast and allows you to pick up any abnormality when it is really early. So what is a mammogram? Mammogram is an X-ray of the breast. So there are a lot of misconceptions that mammogram is very, very painful. I would not say it is painful. It could be a bit uncomfortable. And if you were to do it a week after your periods, it is not as uncomfortable, because when you do it just before your periods, your breasts are kind of heavy and tight. And if you were to do a mammogram, then that could make it very, very uncomfortable. So screening mammograms screening mammogram essentially means that you're doing it every year or every 2 years, as it is happening in the West. If that is done, then it has shown that it does reduce the risk of dying from breast cancer, because obviously you will detect breast cancer early if you were to get this mammogram even before you feel anything. So this is a very, very interesting study that has been done in India. So the West has already, condemned it and said, "Oh, clinical breast examination does not change anything." But then that is because they already have a screening protocol in place. But in a country like ours, in a big country like ours, where it is unlikely that we will be able to screen every woman, clinical breast examination does make sense. And this Tata Memorial initiated study did show that women who were over the age of 50 and were making this visit to see a health practitioner or a health worker to get her breasts examined, the risk of dying from breast cancer reduced by 30%. Now, that's huge. 30% is a huge number, and one should try and make a visit to a trained health worker who can examine your breasts and say if everything is okay or not. Now I come to this weapon that I say is with you. So for all those who want to learn how to do it, so I do have a YouTube channel where I have demonstrated how to do a good breast self-examination. It doesn't take more than 3 minutes. You have to do it once a month, a week after your periods, for those who are still menstruating, and for those who are menopausal, just pick up one day. It could be the first day of every month or a day which coincides with your birthday or anniversary. So what you can do is you don't have to set aside a special time for breast self examination. You could do it while you're in the shower, because in the shower, when you have soap on your body, your hand is likely to slip better on a lump which is there in the breast. And don't use the fingertips. Your fingertips are very, very sensitive. So when you use your fingertips, everything feels like a lump. So use the flat of your hand. The flat of your hand is what should be used to examine your breast. And what you have to do is you have to be very, very systematic. Stand in front of the mirror. Almost everybody has a mirror in the bathroom. So stand in front of the mirror, raise your hands and see if you're able to see that the level of the nipple is at the same site. Is there any dimpling on the skin? Is there any discharge that you can see coming out of the nipple? Is there any change in the shape? Does one breast look abnormally big as compared to the other? A bit of change in the size is very, very common. But if there is a visible difference, a large difference between the two breasts of recent origin, that should be taken into account. So while you do it, you have to do it in two methods. One is that you have to be sitting up, and the other is by lying down. So if you're doing your right breast, use your left hand. And if you're doing your left breast, use your right hand, and do it very, very diligently, systematically. So you can do it round and round like this, or you can do it in a spoke wheel fashion, or you can do it in an up and down fashion, whichever way, but it should cover your entire breast. And when you're running your hand on the breast, don't do this and then go to the other. So just slide your hand, slide, press, rotate, slide, press, rotate, slide, press, rotate, and don't move your hand, just slide and cover the entire breast and the lower half of the breast, which is usually missed, and the central portion where the nipple and areola is. So that is how you have to do. So these are the various changes that should prompt you to meet your doctor, and that is a lump in the breast, and usually a painless lump in the breast. So a lot of times women don't come to the doctor because they say, oh, it's painless, ye to chala jayega, kuch nahi hoga, dard to ho nahi raha. They just wish it away, but it doesn't go away, and it's actually growing inside you. So a painless lump in the breast needs to be dealt with caution. Any changes in the skin of the breast, agar aapka जो स्किन है वो संतरे के छिलके जैसे लग रहा हो, that is an ominous sign. You need to go to your doctor. Any change in the breast size and shape, अगर आपके nipple में से discharge आ रहा हो. Discharge, when I say discharge, is it bloody? Is it transparent? Is it coming on its own? All this becomes important. The spontaneous discharge, which is either watery or bloody, or if there is, and it should not be expressed. So a lot of women come to the outpatient saying कि डॉक्टर साहब हमारे तो इसमें से पानी आ रहा है और कैसे आ रहा है दबाने से आ रहा है कहते हैं हाँ दबाने से आ रहा है सो दबाने से आया हुआ और मल्टीपल डक्ट्स में से आया हुआ डिस्चार्ज इज नॉट इम्पॉर्टेंट but if it is coming spontaneously you must report to the doctor. So a lot of times I have just included this slide in my presentation because I am quite aware that we have to be very, very equitable about how and inclusive about everybody. And if you look at whether this breast cancer has been observed in trans women and cisgender men with a lower risk in trans men as compared with cisgender women. So the absolute risk in terms of the transgender people remains low. So now let me just take you through certain myths that are associated with breast cancer. And this is something that I have to really bust because this is what prevents a lot of women from coming and seeing the doctor. So finding in the lump in your breast means you have cancer definitely. This is not true. ये बिल्कुल बिल्कुल गलत है because you will find that 80% of times the lumps are benign and not cancerous. But the important thing is, how will you know? You will know only if you go and visit the doctor and certain tests are done to be sure, because that reassurance is important to you as well as to the doctor that you are not dealing with cancer and this is just a benign lump. So and leave it alone. Only women with a family history, I've already told you that 90% of women who get breast cancer do not have a family history. Men do not get breast cancers. Again, I've told you that 1% of all cancers that happen in a year happen in men. Only women in their 40s and 50s, I've told you, this is a slightly alarming situation in our country when we are seeing quite a few cancers happening in younger women. So the important thing to understand is you are never too young to examine your breast. Once you're 20 years old, just start getting familiar with your breast. I'm not saying that, your breast could be, bada nodular, gatila ho sakta, it could be nodular. You would think that everything feels like a lump, but that you can go and confirm with your doctor. And once you're reassured that this is your normal breast, continue to feel your breast because anything that happens in that background will be picked up only if you are familiar with your own breast. Antiperspirants and deodorants can cause breast cancer. That's not true. Several studies have been shown to show that this does not increase the risk of breast cancer. And the other thing that often we come across is कि biopsy कर दिया तो फिर भाई cancer फैल जाता है. This is a big myth. There are certain cancers in which we do not stick in a needle to arrive at a diagnosis, but breast cancer is one of those cancers where everything is dependent upon the biopsy. You do arrive at a diagnosis, but you also get to know the character of the tumor because that decides what treatment and in what sequence the treatment has to happen. Mammograms can cause breast cancer to spread. Completely untrue. Mammogram is only an X-ray of the breast and it allows one to pick up cancers early. But if you have a lump in the breast and the mammogram says normal, don't stop at that. You have to go back to your clinician to see its natural conclusion because even mammograms can miss up to 10 to 20% of cancers. And then this is a big myth that if you are at a high risk, you cannot do anything about it. Of course you can. You can improve your lifestyle. You can reduce the pace of your lifestyle. You can minimize alcohol consumption, stop smoking, and incorporate regular exercise in your week. And this is something that obviously you can all drive because I know there are a lot of places, even including in my society, where there have been free yoga classes. So you're doing a great job of reaching yoga to every household. A high-fat diet can cause breast cancer. Well, there is no direct association, but like I told you, obesity can be a breeding ground for all kinds of cancers. An injury to the breast can cause breast cancer. That's not true. A lot of women coming up and saying, मेरे बच्चे ने सर मार दिया, उसके बाद से गांठ. बच्चे के सर मारने में आपको दर्द हुआ तो आपका हाथ वहां गया क्योंकि आपको हाथ लगा के देखने की आदत नहीं है और आप आपने जब महसूस किया अपने आप को तो आपको गांठ महसूस हुई. So it only draws your attention to the point where the lump is. So injury does not cause breast cancer. Only large-breasted women get breast cancer. This is also a myth. This is not true. Any size is not of any concern at all. And if this is the biggest myth, that if you get breast cancer, you will probably die. So now what has happened in the last 20 years is there has been a lot of development in the field of all cancers, specifically breast cancer. A lot of new medicines have come into the picture, very, very effective medicines, which has improved the outcomes of breast cancer. And this is completely untrue. If you were to pick up your breast cancer early, then the outcomes are exceptionally good. So, and the other thing that I would like to say is, if you ever were to come in contact with somebody who's been diagnosed with breast cancer, you should hold their hand and help them through this experience and try and keep them in a positive frame of mind, because I believe it is always mind over body. And a lot of times women are surrounded by people who feed them with negative stories about cancer, which is very, very unfortunate. So it is our responsibility to hold their hand, because breast cancer can strike anybody. It is not, it does not mean that if somebody has had it, the other person may not, because we all share the same environment. And these are things that can happen to anybody. So it is always good to be kind to people who are going through the experience, because it is not easy. And any kind of warmth and compassion is very, very helpful in such situations. So to conclude, breast cancer is associated with a lot of risk factors, but the important thing is the modifiable risk factors is something that you can change. Early detection is what is improving outcomes. And don't forget the three-pronged approach. Mammograms, to, if at all you have to start screening, starts over the age of 40. Under the age of 40, no mammograms. If there is a problem in the breast, under the age of 40, the preferred investigation is an ultrasound of the breast. Over the age of 40, it is a mammogram. Clinical breast examination, very important. Between the ages of 20 to 40, you can visit a doctor once in 3 years. Over the age of 40, every year. Breast self-examination, very, very, very important. Every year, every month, a week after your periods, must be done diligently. Consistency and diligence is what makes a breast self-examination very, very effective. So with earlier diagnosis and improved treatments, we are seeing a lot of courageous women beating breast cancer. Thank you very much.
Thank you so much, ma'am. Thank you for this informative lecture. Sir, ma'am, there are few questions in the comment box. If you would allow me, I will.
Yes.
मैम एक प्रश्न है कि आपने जैसा बताया कि 90% ऑफ जो पेशेंट्स होते हैं ब्रेस्ट कैंसर के, उनकी फैमिली हिस्ट्री नहीं होती है, लेकिन जो 10% है जिनको फैमिली हिस्ट्री जिनकी है ब्रेस्ट कैंसर की, वो ऐसे क्या मेजर्स ले सकते हैं जिससे कि उनको जिस एज में है वहीं पे वो चेक स्टॉप कर सकें, आगे वो नहीं बढ़ पाए?
तो क्या होता है, जिनकी फैमिली हिस्ट्री होती है उसमें उनको एक तो है ना, फैमिली हिस्ट्री का मतलब है कि जैसे मदर डॉटर और सिस्टर जो है ये फर्स्ट डिग्री रिलेटिव्स में आते हैं
जी।
और जो एक सेकंड, मेरा फुल स्क्रीन कैसे होएगा? एक सेकंड, लेट मी गेट टू फुल स्क्रीन। मैं ग्रिड व्यू कर देती हूँ और मेरे को फुल स्क्रीन करना है, पता नहीं हो नहीं रहा है। Have I stopped sharing?
No ma'am, it is still visible.
Still there ना, हाँ इसीलिए नहीं हो रहा। इसको कैसे स्टॉप करें? एक सेकंड। छोटू हो रखा है ये, इसको बंद कर दे तो क्या होगा? ये नहीं हुआ। अभी कुछ और दिख रहा है?
अब नहीं दिख रहा है मैम।
अब दिख नहीं रहा, ओके। So how do I make this big screen? हो नहीं रहा, चलो कोई, अच्छा अब हो
गया मैम।
हाँ ओके। सो जिसकी फैमिली हिस्ट्री होती है, जैसे मैंने कहा कि अगर मदर को हुआ 35 40 इयर्स पे हो गया और एक मासी है जिसको भी 45 पे हुआ। तो हमें क्या देखना होता है कि इंडेक्स केस जब होता है ना, उसके 5 साल पहले से स्क्रीनिंग शुरू हो जाती है, 5 या 10 साल पहले यू विल स्टार्ट स्क्रीनिंग। तो आपको उस समय डॉक्टर के पास जाना होगा। और जब इतनी ज्यादा फैमिली हिस्ट्री होती है तो फिर हम जेनेटिक टेस्टिंग भी करते हैं देखने के लिए कि भाई कोई जीन म्यूटेशन तो नहीं हो रखा है, क्योंकि ये तो हाई रिस्क कैटेगरी में आ जाते हैं। तो हाई रिस्क को अलग तरीके से देखते हैं और जनरल पॉपुलेशन को अलग तरीके से। तो जिनकी फैमिली हिस्ट्री नहीं होती है उसको हम कहते हैं कि आपका तो जनरल पॉपुलेशन रिस्क है, जैसे किसी का भी हो सकता है। तो उन लोगों को कहते हैं कि भाई आप 50 साल पे शुरू करोगे, हर 2 साल में या 3 साल में करेंगे, उसके बाद 50 इयर्स के बाद तो अमेरिका में हर साल करते हैं। और यूके में जो है जिनकी हाई फैमिली रिस्क होती है तो वो 18 महीने में करते हैं, और जिनका जनरल पॉपुलेशन रिस्क होता है वो 3 साल में करते हैं। तो हमें भी कोई बीच का रास्ता निकालना होगा, क्योंकि जैसे हमारे तो कोई रिकमेंडेशंस है नहीं, लेकिन जो करवा सकता है उसको जरूर मैमोग्राम करा के देखना चाहिए। पर अगर किसी को बहुत हो जाता है तो मैमोग्राम वो इन्फॉर्मेशन नहीं दे पाती है।
जी
तो अगर यंग, मतलब मेरा कहने का मतलब 35-30 इयर्स में भी कभी कभी हो जाता है, तो उसमें हम लोग एमआरआई का इस्तेमाल करते हैं, पर एमआरआई इज नॉट द फर्स्ट इन्वेस्टिगेशन। तो ये सब बातें जो है ये आपके जो डॉक्टर है वही बताएंगे, क्योंकि एकदम से हम सारी चीजें एक साथ नहीं करते, हम बारी बारी से चीजें करते हैं। एक तो ये हो गया। इसके अलावा जैसे मैंने बताया आपको, जो लाइफस्टाइल मॉडिफिकेशन कर सकते हैं वो तो जरूर करिए।
जी
ये फैमिली हिस्ट्री वालों के लिए भी लागू है और जिनका नहीं है उनके लिए भी लागू होता है।
जी मैम, ऐसे कुछ वैक्सीनेशन भी जैसे ऐसे कुछ डेवलप हुए हैं क्या, कुछ टेक्नोलॉजी?
ब्रेस्ट कैंसर के अगेंस्ट वैक्सीन अभी डेवलप तो नहीं हुआ, लेकिन ये भी वर्क इन प्रोग्रेस है, इस पे भी चल रहा है काम। पर जिसके अगेंस्ट वैक्सीन है वो है सर्वाइकल कैंसर।
सर्वाइकल कैंसर, यस मैम।
एंड सर्वाइकल कैंसर का मतलब होता है बच्चेदानी के मुंह का कैंसर,
जी
है ना। तो ये जो अभी इसका जो था, पहले तो वो 2 वायरसेस के अगेंस्ट वाला वैक्सीन आया था, फिर 4 वायरसेस का आया, और अब जो है 9 वायरसेस के अगेंस्ट, नॉनावैलेंट कहते हैं उसको, नॉनावैलेंट वैक्सीन। अगर आपको मौका मिलता है तो जरूर लगवाइए, खासकर यंग वुमेन, दे शुड गेट वैक्सीनेटेड। इसकी जितनी स्टडीज हुए हैं वो 9 साल से लेके 25-30 साल तक की महिलाओं में हुआ है, लेकिन ये वैक्सीन आप 45 साल तक भी दे सकते हैं। इसका इफेक्ट सबसे अच्छा होता है जब यंगर करते हैं, क्योंकि यंगर की इम्यूनिटी अच्छी होती है तो वो ज्यादा अच्छा उसमें असर आता है, और प्रेफरेबली सेक्सुअल एक्सपोजर से पहले। और अगर सेक्सुअल एक्सपोजर हो भी गया तो इससे मतलब इसको लगाने से मत चूकिए, क्योंकि आप वैक्सीन भी लगाइए और हर 3-1 साल में पैप्समियर भी कराइए अगर सेक्सुअल एक्सपोजर हो चुका है तो।
इन अ नटशेल हम कह सकते हैं कि अगर हम अपनी लाइफस्टाइल में चेंजेस कर लें, जैसे एक्सरसाइजेस को, योगा अगर हम लाइफस्टाइल में इंक्लूड करें तो काफी हद तक हम इन सब चीजों से, कैंसर से बेसिकली, और बाकी भी और जो डिजीजेस हैं उनसे बच सकते हैं।
मैं ये जरूर कहूंगी आपको कि मैं एक और स्टडी था, मैंने वो इंक्लूड नहीं किया, ये भी टाटा मेमोरियल में ही हुआ था, और वहां पे उन्होंने देखा योगा, जो जो महिलाएं जिनकी कीमोथेरेपी चल रही हैं और वो योगा का प्रैक्टिस करती हैं, उनके जो साइड इफेक्ट्स होती है ना, साइड इफेक्ट प्रोफाइल काफी चेंज हो जाता है। स्पेशली मतलब सूर्य नमस्कार और इवन व्हाट यू कॉल ब्रीदिंग एक्सरसाइजेस, all has been found to be improving ये जो साइड इफेक्ट प्रोफाइल है उसको इम्प्रूव करता है। तो हमने भी अपने इंस्टीट्यूशन में, मतलब इस बात को हो गए अभी 6-7 साल, हमारे साथ एक योगा इंस्ट्रक्टर है जो शी वर्क्स विद अस, विद आवर पेशेंट्स, एंड शी टीचेस देम योगा। और ये सारे जो महिलाएं हैं ये योगा करती हैं और इससे बहुत फायदा होता है। तो मैं तो कहूंगी कि अगर आप हमारे साथ जुड़ के ऐसे कोई स्टडी लार्ज स्केल पे करना चाहें तो ये तो बहुत अच्छा होगा। वी कैन डू एक्चुअली डू अ मल्टी इंस्टीट्यूशनल स्टडी, और दिल्ली में ऐसे कई कैंसर सेंटर्स हैं। अगर अगर आप अपने हमें आप हेल्प करेंगे इस चीज में तो वी कैन डू दिस ट्रायल विद इन आवर पीपल। और भाई हम ही लोग योगा के शुरुआती हैं, तो हमें सारी दुनिया को बताना है कि भाई ये करने से बहुत फायदा होता है। आप एक मॉड्यूल ऐसा क्रिएट करिए जो कि हम हर मरीज तक पहुंचा सकते हैं। और मान लीजिए हम अगर ये फिजिकल फॉर्म में नहीं भी कर सकते हो, तो अगर हम ये मॉड्यूल क्रिएट करें जो हम ऑनलाइन बेसिस पे कर सकें, या जिस तरह से, बड़ा स्पेसिफिक मॉड्यूल होना चाहिए। और हमें ये भी ध्यान रखना है कि जो कीमोथेरेपी पे जो मरीज होते हैं उनमें थकान और ये सब चीजें बहुत होती है, तो उनसे जो आराम से हो जाए लेकिन उनको इफेक्ट उतना ही अच्छा मिले, अगर ऐसा कुछ कर सके तो बहुत अच्छा हो जाएगा।
जी मैम, बहुत बहुत धन्यवाद आपका कि आपने हमारा आमंत्रण स्वीकार किया और ब्रेस्ट कैंसर अवेयरनेस जैसे इस ज्वलंत मुद्दे पे, ज्वलंत विषय पर हमारे दर्शकों दर्शकों को इतनी अच्छी जानकारी दी। मोरारजी देसाई राष्ट्रीय योग संस्थान की तरफ से और स्वयं अपनी तरफ से मैं आपके प्रति हार्दिक धन्यवाद ज्ञापित करती हूँ। बहुत बहुत धन्यवाद मैम। साथ ही मैं धन्यवाद देना चाहती हूँ हमारे संस्थान के निदेशक महोदय डॉक्टर ईश्वर बसवरेड्डी सर का भी, जिनकी प्रेरणा और ऊर्जा से इस प्रकार के कार्यक्रम संपन्न हो पाते हैं। बहुत धन्यवाद आपका भी सर। साथ ही धन्यवाद है संचार एवं प्रलेखन अधिकारी मोहम्मद तैयब आलम सर का और हमारी तकनीकी टीम का और हमारे सभी दर्शकों का जो इस कार्यक्रम में हमारे साथ जुड़े। और संस्थान की परंपरा के अनुसार कार्यक्रम का समापन शांति पाठ के साथ करेंगे। ॐ सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। बहुत बहुत धन्यवाद मैम।
थैंक यू सो मच डॉक्टर वंदना। डॉक्टर इंदु को भी मेरा बहुत बहुत धन्यवाद। थैंक यू सो मच।